Why are Nigeria's testing numbers so low? Many have been forced to ask. And how do these numbers compare with those other African countries that have already seen a relative explosion of COVID-19? Ghana, Senegal, and South Africa are three other countries on the continent already posting significant figures in terms of infection and deaths. But their governments, including that of Nigeria, have also been trying to ramp up the numbers in terms of testing. And so how do these countries compare in terms of testing for COVID-19? We'll now try to get a comparative analysis of this factor among the 4 African countries and other African countries as well, concentrating, as it were, on the disparities in testing methods and the capacity of each country to deal with the pandemic by talking to Dr. Abasi Ene Obong, a geneticist and research scientist, as well as founder 54G. Dr. Ene Obong, welcome to the morning show. Thank you for joining us.
Welcome to the morning show. Thanks for joining us.
Good morning.
Good morning. Dr. Ene Obong, well, testing has been the big issue. Dr.
Yes.
Tedros Ghebreyesus, the Director General of the World Health Organization, had cause on one occasion to say that part of the solution to COVID-19 is to test. And understandably, that will help. But Nigeria has had cause to respond to protests, if you like, complaints, that the country is not doing enough in terms of testing.
Yeah.
And I quote Minister Hanire, the Minister of Health. He said what Nigeria is doing is smart testing. That's what he calls it, as opposed to blanket testing, which he says is what is being done in Ghana.
Yeah.
Now, is testing such a myth? Is it rocket science? What is the best approach that you would recommend for Nigeria? And what's your assessment of what Minister Hanire calls smart testing?
Okay, thank you so much for having me here this morning. So the first thing is to really understand why there is a delay in testing. And the reason is because for COVID-19, you need what we call molecular diagnostics testing, so PCR-based testing. I know that there are rapid diagnostic testing out there, but it's been shown that the current rapid diagnostic tests have very low precision, so 40% precision. And so that doesn't really tell you much. If anything, it's a detriment to the system right now. And we have rapid diagnostic tests that various companies across the world are trying to improve the precision for. What we know actually does provide real precision is what we call PCR-based tests, polymerase chain reaction type tests. Now, the issue is that in Nigeria, compared to, let's say, South Africa, Nigeria has not built molecular diagnostics capabilities. Molecular diagnostics are the types of tests you will use to test for COVID-19, Lassa fever, and cancers, right? And if you notice, before the COVID-19 hit, if somebody had cancer in the country, what typically would happen is that most labs in the country will send their samples to South Africa or to Europe or the Middle East for testing. And so most of the labs in Nigeria got lazy. They didn't build these capabilities, and they were relying on other labs outside the country. On the other hand, the public labs were not funded, right, to do proper disease surveillance, and so they didn't have these capabilities. And so what then happened was when COVID-19 hit and all the world's borders got shut and everybody started looking internally, right, every country became sort of nationalistic. There was no place to send samples out to again because there was no capacity anywhere. And so Nigeria started from behind trying to build the capacity to test. Now, when we say build the capacity to test, we mean trying to get the right equipment. Now, mind you, lots of countries across the world are fighting for the same equipment. The US is trying to buy up all this equipment. The UK is trying to do the same. Right, so you're now in competition with really powerful world powers. Right, so the equipment are now scarce. The second aspect is that the reagents are also scarce. Right, and so what we've now been doing in Nigeria is we've been trying to catch up. And that's...
Dr. Ene Obong, if you could just hold your thoughts for a brief moment. Let's go on a quick commercial break, and when we are back, we will continue with this conversation. Stay with us. Welcome back to the morning show here on Arise News. Dr. Abasi Ene Obong, a geneticist and research scientist, as well as the founder of 54Gene, is still here with us on the morning show. Doctor, thanks for staying with us. Before we went on a brief break, you were making a point.
Yes, and so because when this whole virus scenario started, we had the capacity in the country to do about 150 tests a day, right? Which isn't much for a country of 200 million plus people. But what has been happening at the back of the scenes is that we've been building the capacity and the capability to do more testing. And I can tell you, based on what I know, that we're about to see quite a ramp up in tests in the country. Now, to answer the question about the minister's statement, obviously when you have little or low capacity, you have to then try to prioritize who gets access to testing. Right, so that the most vulnerable, the people who need it the most get it. And that's what Nigeria we've been doing so far. But we're about to see testing skyrocket within the next few weeks.
And that is great news, Doctor. And I believe that yesterday, 54Gene, you also launched your first mobile laboratory, first COVID-19 mobile laboratory to assist as well with testing capacity. Can you tell us more in this regard?
Yes, so we do have a laboratory in Lagos that can do quite a number of tests a day. I'm trying to not talk about the exact numbers. However, what we did was we understood that because of the lack of the reduced capacity in the country, a solution was to create a lab that we could transport. Essentially, we build labs in shipping containers. To NCDC standards, it's approved. It follows the same standard operating procedures as our lab in Lagos. And we staff the lab with research scientists that have experience in molecular diagnostics. And we also even do further training for those research scientists. And then we can go to, what that means is that we can easily deploy a lab within 1 to 2 weeks in a new state. So we got the approval yesterday to provide COVID-19 testing, and yesterday was when we launched the Ogun State Lab. By this weekend, we will be in Kano State.
Well, Dr. Ene Obong, let's go back to the comparative analysis that we were trying to do. Dr. Ihekweazu, the head of the NCDC in Nigeria, is insisting that, just like the minister, Ihanire, is insisting that Nigeria will not adopt the approach for testing that has been adopted in Ghana. Now, in Ghana, Professor Ampofo is saying that the method that they have adopted in Ghana yields better results because it's a system that has been in place since 1945. Now, when you go to Senegal, they have a different system in place. I know you said that rapid diagnostic testing may not be precise, but what will you recommend to Nigeria and the other countries, and are there lessons that we can learn? Because as at yesterday, we had a feature from Senegal showing that Senegal seems to even have a better system in place in terms of getting results.
So one of the things I have to say about the Senegal news, and I'm very happy when I see African countries looking inside and trying to see how they can innovate to solve problems. But one of the things I have to say about that Senegal rapid diagnostic test is that it hasn't yet been validated, right? So yes, it's shown promise, but it still needs to go through the appropriate authorities that are reviewing all these tests or all these test platforms. And it still needs to come back saying this is how specific it is. We don't know the specificity yet of that test. We hope it's good because it will really make a difference if it comes to Nigeria. But I would like us to just, it's something we still need to watch closely. Where Senegal too might have excelled is the case management of COVID-19. Now, bear in mind, Senegal is a country that is not as large as Lagos State, right? So some of those comparisons you need to have that at the back of your mind. Nigeria is a more complex organism. Ghana, too, is just as big as Lagos State, right? But again, the testing used in Ghana isn't what is being used in other parts of the world. Ghana is extrapolating that, well, I've been told that their method is extrapolating. So it's not actual number of tests performed that is being used in Ghana. In Nigeria, we're looking at the actual number of tests performed. Now, what the NCDC DG is referring to is, if you're managing public health, you have to look at both sides of the equation. You don't want to flood the system. There has to be a balance between supply and demand, or at least you try as much as possible to create a balance between supply and demand. If we scale tests to, let's say, 100,000 tests in Nigeria, at the current rate of infections we're seeing, who knows, we might see 50 to 100, we might see 5 to 10,000 infected people in Nigeria at 100,000 tests if we do that. Now the question becomes, how do you treat those people? How do you isolate them? How do you provide treatments? And so capabilities have to match. And I think that's what Nigeria has been trying to do, to make sure that we are sort of managing the curve to have the right capabilities to handle that flood.
Certainly, Doctor. We're going to definitely come back to this and speak more on that. But you brought up a point, and it gave me sort of a light bulb moment, because pools of genome sequences for SARS-CoV-2 are currently going on all around the world. And scientists are really, really scrutinizing to really try and find the vaccine through different strains. Now, there is a worry that Nigeria and Africa may end up with a rotavirus vaccine problem, which is what occurred when, of course, the rotavirus vaccine was developed. But the strain that they used was more to do with people that were based in Europe and North America, and therefore it was less effective in Africa. Do you see this as a problem that is going to occur in Nigeria, and what is being done by 54Gene and other companies in order for us to do more genome sequencing so that we can avoid this? Because I believe we've done less than 100 across Africa out of about 7,600 worldwide.
Yes, and Nigeria has contributed one to that, but I thank the people who were involved in that: Professor Happy, Professor Salako, Professor Nash, and Professor Kinabayomi. They really led the sequencing of the first, of the first virus, the first strain. But you're right. You're correct in your assessment there. One of the things that we really need to do as a continent is begin to have ourselves represented in global healthcare research. In fact, that was the premise of founding our company, 54Gene, because we noticed that Africans were really underrepresented. Of all genomic sequences that exist in the world, Africans contribute to about 3% or less. Right, and so there is a real danger, and especially also with all these conspiracy theories going out there about vaccines and how vaccines are bad and how some wealthy people are trying to use vaccines to do stuff in Africa. It's a limiting factor. We have to be represented in the places that are making this vaccine. The strains of the virus need to be represented. We need to be able to study virus and host interactions. So essentially, understanding why some people may have the virus and not have symptoms, or the reason why certain drugs work in certain people and don't work in other people. Now, what we as 54Gene are doing, we just got the approval, as you mentioned, to start doing testing. One of the things in our pipelines is to then add sequencing as part of a research effort to really increase the number of sequences that we can produce from Africa to contribute to this global pool of knowledge to help ensure or to do our own part to prevent the rotavirus incident.
Well, Dr. Ihekwazu has had to, cry out that Nigeria has a shortage of what he calls RNA extraction kits.
Yeah.
Now, how does it go about that? Does it mean that we have a problem with testing kits in Nigeria? And how do we address that at this moment? You had said earlier that we had a problem of capacity before COVID-19 and we're just trying to play catch up. But if we don't have enough testing kits, what are the implications? What are the consequences? And then beyond that, in many parts of the world, we've been told that many of these testing kits give false reports, false results. Now, is that a problem with the reagents? And how do we in Nigeria make sure that even in our search for testing kits, we don't end up with the wrong ones?
So, yes, so the testing kits that we know may give the wrong results are most of the rapid diagnostic test kits. You know, they use like the antibody antigen test kits. And that's why the NCDC and WHO came out against them for use now. It's not that we will not use them at some point. We will use them, but we will use them when they are precise enough, when the accuracy is high enough. And so I will caution people who might be buying rapid diagnostic kits from other people. Those are not yet approved, and you are not sure what that is telling you. Now, the tests that are confirmed are the PCR-based tests. And let me explain how the RNA extraction kits that Dr. Chikwe was mentioning was, cried out for. Now, when you get a swab, right, which is like a saliva-type sample from somebody, you need to then extract the RNA virus from that swab, right? And that's when you use the extraction kit. After you then extract the RNA virus, then you need to now run the PCR test using a detection kit. Now, the issue that we have is that if you cannot extract the virus from the samples, then you cannot do the test. And so that becomes a bottleneck. And we've been involved with the NCDC and some others in trying to source extraction kits. Like we mentioned, lots of people across the world are trying to get these kits, and we need funding. Funding is needed to buy these kits. And the issue too is there's a long lead time. You know, we need to plan ahead. We need to be buying kits that we'll need for the next 2-3 months today. Right, but if you're trying to buy kits that you need for next week today, it's most likely you're not going to find a manufacturer or supplier anywhere in the world to provide that to you. So that's the issue we have.
The capacity as well of the personnel in the country that we have running these labs and diagnostic centers to ensure quality control. What can you tell us in that regard?
So in terms of the personnel, again, you have to be well trained. And that's another issue that limits the ability to skill testing. If in a country, when you look at in Nigeria, most of our educational system or the universities in Nigeria don't have functioning molecular biology labs. I studied genetics and biotechnology in Nigeria before I furthered my studies abroad. And I can tell you that I didn't work in a lab. It was all theory for me, right? I remember when I had to go do my master's at Imperial College, and my first day in the lab, I didn't know how to use a calibrated pipette. You know, I was so backwards in terms of practical, right? So when you have, in the first place, you have few universities providing molecular biology type training, and the ones that do, majority of them don't even have functioning labs. It's difficult to then quickly upskill graduates of those courses in practical. It doesn't take 1 week, right, to upskill them. It takes longer than that. And so we have been doing, we've been calling, we've been making calls out. And if anybody's watching here and you have molecular biology skill set, you have done PCRs before, please reach out to us, reach out to 54Gene, reach out to the NCDC, reach out to anybody who is currently doing this, because there is a shortage of personnel. But I can say that the current people who are doing this test are properly trained. There are not so many of them, but the ones currently doing it are properly trained. We need more people who perhaps have worked in labs or studied abroad or something to come back to help, and we're looking at ways we can also develop the capabilities of people in Nigeria as well, who may have the theoretical knowledge but not the practical knowledge, because we need to start thinking about the future and not just tomorrow.
Well, Dr. Ene Obong, let's talk about the race for finding a vaccine to solve this COVID-19 pandemic crisis that the entire world faces. Only last week at the University of Oxford, a team led by Professor Sarah Gilbert started the COVID-19 trials, vaccine trials. But that didn't seem to have produced the kind of result that we expected, despite the fact that Professor Gilbert promised that by September, progress would be made, and she was 80% sure that the United Kingdom will be the first country to find a cure. In other places around the world, there's also that race for a vaccine. What do you think? What are your projections in this regard as somebody who is involved in the field of science?
So vaccines are very difficult to produce. Vaccines typically take more than 5 years to produce, right?
Wow.
And I think because of how the COVID-19 issue is affecting all of us, the world's regulatory bodies are looking for ways to speed up that process. The first vaccine for COVID-19, we will be lucky if we have a vaccine this year. If we do, it will come at the end of the year, and that would make it the fastest vaccine to ever be made. But there is no guarantee that that's going to happen. So you have different companies working on vaccines. You have Moderna. Moderna has just recently received nearly $500 million from the US government to fund their vaccine program. The other thing to note is that vaccine discovery and production is very expensive. Typically takes more than $100 million to get a vaccine to market. And sometimes, many times, you will lose that $100 million, right? So it's like the space race, when countries were trying to see who would get to the space first. Countries are now trying to compete on getting a vaccine ready. Obviously, because if a country can have a vaccine ready, that country is going to prioritize its own citizens first, right? So there's going to be some more inequality happening in the world very soon, right? Because if the first country, even if a country gets vaccine to take care of its own country first, and then another country, before it gets to us, it might be tricky, right? But the first vaccine is probably not going to come out till the end of the year. And there are different groups working on vaccine production. I think as a country, we need to start, and a continent, not just a country, the African continent, we need to start looking internally at how we begin to develop many of these science programs ourselves, right? So that we can take advantage of situations like this, in the sense that we can also take care of ourselves. That's what I mean by take advantage. Yeah.
Certainly, Doctor, and looking within is something that is certainly happening now, which brings me up to the next point, because a Series A funding of about $15 million for a health tech startup is nearly unprecedented in Nigeria today. You normally hear about it happening with fintechs, etc., but the pandemic has shone a light on the health sector, and this is something that we hope is going to continue post-COVID-19 as well. How do you see the health and the technology sector in Nigeria growing post-COVID-19?
Well, we need national forces to also begin to take an interest in science, right? So we are lucky that, yes, we were able to raise investment. And we set out, we have now set out to become a company that is building the capabilities necessary to potentially discover a new drug. It's going to take time. It takes time to develop a new drug. Sometimes it takes as much as 10 years. And so, in the US, in the UK, in other markets, they are used to investing in biotech companies, understanding that it could take as much as 10 years to see a result, but that result can be groundbreaking, and also can be, groundbreaking in the sense that it saves lives, and it can also be commercially lucrative. We haven't, in the sciences field, as a country and as a continent, we haven't looked past the next few months or the next few years. And we need to begin to start looking at how do we develop our own drug discovery programs. Japan does, there's lots of countries across the world that the governments are very active in trying to look at the diseases that their country, their citizens or residents are facing. That's even data that we don't have in Nigeria to know these are the endemic diseases. What we are seeing from our own research is that just the sheer numbers of of non-communicable diseases like cardiovascular issues, cancer issues, neurodegenerative issues like Alzheimer's, dementia that are going on in this country. And we need to begin to pay attention to what's happening. We need to fund our universities. We need to fund companies that want to make a difference in this space. And I think that this is a time for countries to begin to look internally and begin to strategize for the years to come.
Well, Dr. Ene Obong, I would like to ask you not a question related to science now, but to policy. Yesterday, President Buhari addressed the nation, and there are indications, clear indications in that speech, that by May 4, the federal government of Nigeria hopes to relax the restrictions in Ogun State, Lagos State, and the Federal Capital Territory, although there is a caveat, I think in paragraph 39, where the president said very clearly that the state governments in the affected areas can take their own decisions depending on their circumstances. Do you think that the time has come for Nigeria particularly to relax the lockdown? Do you think that if we relax the lockdown, we face the threat of a second wave or a third wave? Or you think that perhaps businesses should just be allowed to move on because the people need to feed and business people need to make profit?
So that's a very good question, and I'm happy you said it's one of policy. What we are seeing is that countries that take very extreme measures to lock down and drastically reduce the curve, when they reopen their economy, they start seeing a second wave, right? And one of the things I'll say, though, is that COVID-19 hasn't gone anywhere. COVID-19 is very much in Nigeria and is very much in the world, and it's going to be that way for quite some time. Now, I was saying that obviously if I put on my scientific hat, I would say yes, we need to lock down and keep lockdown for as much as we need to. But I also have to look at the realities on the ground, the hunger, the starvation, the poverty, and it's a tricky situation. Africa is not the U.S., and I mean the U.S. economy is being beaten hard, but Nigeria is not the U.S. I mean, it's a difficult question to respond to. I think that one of the things that could help is really getting the right minds together to begin to see how we can innovate for our own particular predicament. Maybe it's a situation where, you have essential workers going to work. I know that when the shutdown is called off, my staff who are not working in the lab, I'm not going to require them to come to the office. Unless those who have to go to the lab, right? And so we have to take this balanced approach. I think it's going to get to a time businesses have to look internally. Management will have to decide what works. But there are industries that need to work, right? So you need manufacturing industry, you need food, right? What happens to the people making our foods? If there is no more Indomie or Nestle or whatever, what happens to, and then what happens to farmers who need to farm and put tomatoes and yam and all of that on the table for us, but also for themselves. So it's a tricky situation. It's one that requires proper policy planning, not one that should be made loosely, but one that if we're going to take that call, we need to come up with a design, a model that may give us a chance of having a life while also trying to reduce the virus spread.
Certainly, and you made a very good point. You said COVID-19 isn't going anywhere, and that is certainly just the reality that at some points we're all going to have to accept. But one thing is clear is that institutional voids have to be filled, and we have seen several institutional voids in the health sector. What key health interventions would you like to see going forward, both from public and private sector?
Are you asking for COVID-19 or post-COVID-19?
Post-COVID-19.
So we need to invest more in our hospitals. I mean, as a business person, I have another thought for how the capital markets could actually improve businesses. The healthcare sector. one of the reasons that we don't have very good healthcare system in the country is just because of how granular it is. You have hospitals everywhere. Obviously, we don't leverage the power of group buying, which reduces costs, which means that we all have to compete. And so there are capital type, approaches. But there's also, government type approaches. We need funding. A healthcare budget has to go up, and the actual budget that is released, or the actual portion of the budget that is released, should also have to go up. There are very brilliant people in the healthcare sector in this country, I have to tell you. There are people who've worked in all of the leading institutions across the world who are in Nigeria at the moment. And we just need to create a suitable environment for them.
Ene Obong, thank you for spending the last 30 minutes with us.